and we're live on YouTube. Good morning, everyone. Good morning to our media partners and to our esteemed guests. Welcome to Monday's Media Forum, April 19. To formally introduce our guest speaker for today, we have with us the Undersecretary of the Department of Health and the official spokesperson of the Department of Health, Yusek Maria Rosario Singreher. Yusek?
Yes, magandang umaga po sa inyo lahat. Welcome to our Monday's Media Forum. Ngayong araw, makakasama po natin si Undersecretary Myrna C. Cabotaje from the Field Implementation and Coordination Team ng DOH. Siya rin po ang head ng aming vaccine cluster dito sa Department of Health. She would give us updates on the national vaccination deployment program natin at sasagot din po siya ng mga ilang katanungan galing sa inyo. So, Yusek Myrna, the floor is yours.
Salamat Yusek Rosette. Magandang umaga po sa lahat ng ating mga media partners in this media forum. So, can we have the first slide? May konting presentation ako. Sasabihin ko sa inyo kung ano ang nangyayari sa ating vaccination rollout. Sa pagtutulungan po ng lahat, yung whole of government, whole of society approach. Next slide, please. Naitala natin ang 1,400,000 na nabakunahan na to this date, no? So in terms of the ranking natin sa Asean, pumapangatlo tayo sa Indonesia and Singapore. May mga problema sa supply, but even then yung mga dumating sa atin, we were able to administer many of them. Kaya may 1.4 million na tayo. Next slide, please. Of these 1.4 million na ibakuna na, may 1,264,000 tayong first dose. Ito yung first doses ng Sinovac at saka AstraZeneca kasi sila lang ang dumating sa atin. Tapos nakakumpleto na ng 191,982. Ito po yung ating mga healthcare workers, no? Or workers in frontline health services. So about 76% of the jobs were given to our healthcare workers, tapos 10% sa ating senior citizen, tapos 14% sa ating mga individuals with comorbidities. These are reports from 3,155 sites. So the next slide will tell us that ang mga bakuna na naibigay na po sa atin. Next, may donation po tayo sa Sinovac na 1 million dumating ng February and March. Tapos may donation po tayo sa COVAX ng 525,600. Yung mga Sinovac po, kailangan naka-ensure yung kanyang second dose kasi 28 days. Yung ating COVAX, ginawa po natin lahat first doses kasi ang susunod na dose niya ay 3 months after. Tapos dumating na po yung pre-procure natin na Sinovac na 1.5 million at lahat po ito ay na-distribute na sa buong bansa. Next slide, please. So in terms of the vaccine supply, we have already a total of 3,025,600 vaccines that have been delivered in the country at ang naitusok na ay 1.2 million tapos 191 sa second dose. Alam natin limited ang supplies kaya dapat ang prioritization framework ang ating isinisakatuparan with the most at risk and most vulnerable ang ating primordial concern. Sa ating vaccination rollout, sa umpisa, inimit natin sa mga health workers. Pero ngayon, may simultaneous vaccination na po, yung tinatawag natin priority group A1 or workers of the frontline health services, yung 80 or senior citizens and the A3 or the persons with comorbidity in the NCR plus bubble kasi alam natin tumaas yung mga kaso at importante mabakunahan tayo for some protection. And in some areas, hindi lang sa NCR plus bubble, vaccination of A2 in senior citizen has also started kasi nga nagsasurge ang cases and a significant portion of A1 were vaccinated already. I think that's the next slide on master listing. Ongoing po ang master listing ng ating LGUs. Gusto lang natin iklaro na yung ating attested master list, ito yung mga healthcare workers na namasa sa ospital. Yung mga senior, tapos yung mga comorbidities, hindi na kailangan ng attested. Nagre-register lang sila para malaman ng LGU ilan ba yung mga kailangan nilang bakunahan. No? So, kailangan alam nyo yung grupo and you are part of the registration or master listing. Pero hindi ibig sabihin na kung kayo ay na-master list na, mabibigyan ka agad ng bakuna. Depende po sa supply na darating. So, importanteng coordination with the LGU. Importante din sa communication, marami pa po sa atin ang mga vaccine hesitancy, including sa ating mga healthcare workers. Although they were already given right of first refusal sa Sinovac, tapos may Astra, there's still some portion of them who do not want to be vaccinated. Ang importante po, vaccines work and getting vaccinated with the available vaccines in the country can prevent severe COVID-19 disease and thus prevent death. Yan lang po ang ating presentation and we are now open to questions, Ms. Nikki. Yusek Rosette.
Maraming salamat po, Yusek Mirna, for giving a brief update po with regard to the vaccine rollout sa bansa. Yusek will open the floor for questions from our media. We have a few po from our media partners. Let me just get the questions po. From Red Mendoza, Yusek Mirna, may data po ba tayo ng mga umuurong ng mga tao dahil natatakot magpabakuna? Ilan po sila across the country? If you have this data po, Yusek.
Meron tayong data ng deferral. Ibig sabihin na for a later date yung mga vaccination because of several issues, yung tumataas ang blood pressure o hindi pa ready. May mga konting refusals, but offhand, we will look at the data of the refusals. Kasi nga, bago pa sila mag-register, dapat may set na yung mind nila na magpa-bakuna. So I don't have the data now on the refusals. Let me look at the refusal. Kasi we are banking na pag pumunta na sa health facility, ready na siyang magpabakuna. So to date, we have a refusal of refusals. Deferrals is ano ba yan? About 54,179. Yung refusal, wala kaming date. Kasi hindi nga sila pupunta dyan pag ayaw nilang magpapakuna.
Thank you po, Yusek Mirna. From Caroline as well as from Miguel Flores, they're asking related questions po. Bakit daw po ang comparison ng data natin is versus Asean nation ay based po on doses administered, not persons vaccinated or percent of population inoculated? In relation to that po?
Yes, ang ating comparison ay number of administered doses kasi that will tell us gaano karami yung nakukuha nating mga doses at gaano tayo kabilis magbigay ng mga doses. Ang mga iba-ibang vaccine kasi generally 2 doses except for Johnson & Johnson na 1 dose. Tapos po, iba-iba yung kanyang interval. No? May 21 days, may 28 days, may 3 months. So ang i-report lang ay yung number of doses. Yan naman ang ginagawang indicator internationally.
Thank you, Yusek Mirna. In relation to that po, from Miguel Flores, where do we rank in the region based on doses administered per adult population?
Lahat naman ito ay adult population kasi yung ating 18 to 59, yan lang po ang ating binabakunahan. Alam naman natin yung ating mga healthcare worker ay mostly in the adult population. Tapos yung, anong tawag dyan, yung mga frontline, ay yung mga senior citizen at saka yung ating mga comorbidities ay generally the adult population. So sa ibang bansa, ganun din ang kanilang mga binabakunahan. 18 to 59, except if you have the Pfizer, pwede yan sa 16 years old. But generally, hanggang youngest 16 ang nababakunahan pa lang. Salamat po.
Salamat po, Yusek Mirna. This is for Yusek Mirna as well as for Yusek Rosette po. Is the DOH studying or considering giving mRNA vaccines as boosters for people who got Sinovac, considering this is the main vaccine being used right now in the government's vaccine program? Yusek Mirna, go ahead po.
Ang mga studies sa the clinical trials say, the current data say na tama na yung 2 dose ng Sinovac at the moment, but as we gather more evidence in the future, then titignan kung may booster dose. Maybe Yusek Rosette can add to this.
Go ahead, Yusek Rosette.
Kung kailangan pa ng booster dose after, we will need to know the studies after several months. Kasi inaaral pa rin. But as of now, based on clinical trials, okay pa yung 2 doses ng Sinovac vaccine.
Okay po. Thank you po, Yusek Mirna. Next question po from Sofia Toma Cruz. An update daw po of vaccines which are expected to arrive in April and in May. Are there any developments here po?
Yes, ang April may dumating na tayong 500,000 Sinovac na pinocure. There's another 1 million that's arriving, 500,000 on April 22 and another on April 29. My indication, it can always change, that we may have some Pfizer vaccines that are arriving end of April, and also Gamaleya Sputnik V. May konting initial 20,000 doses. Ang Gamaleya kasi magkaiba yung first dose at saka yung second dose. So yung 20,000 2 doses na yan, minus 18 degrees centigrade. So i-simulate, ipapractice muna natin. And then the remaining might be arriving, mga 480,000 Gamaleya Sputnik V arriving by end of April. In May, we are expecting another about 2.5 million of Sinovac, and we are expecting the AstraZeneca from COVAX, hopefully by May or at the least very early part of June, to cover yung second dose natin ng binigay natin na all first doses na 525. So may mga 900,000. Marami pang nakalaan na mga vaccine, but it's still the global shortage and kung siguradong dadating o hindi. But we have already signed, Secretary Galvez has already signed the supply agreement. It's just the availability of the vaccine on these dates.
Thank you, Sec. Mirna. From Greg Gregorio po, as of current priority list for vaccination, saan po kasama ang persons deprived of liberty? Commission on Human Rights is calling for the PDLs to our priority list for vaccination. If you have any reaction to this po, Sec. Mirna.
As of now, the persons deprived of liberty are under priority B. Ang priority A natin, A1, frontliners, A2, senior, A3, comorbidity, A4, yung economic frontliners, tapos A5, yung ating indigent population. Pero yung mga jail guards, yung mga those who are watching over them are part of A1. So nasa B4 sila, social demographic groups at significantly higher risk other than senior citizens and poor population based on the NHTS PR.
So that's clear po. PDLs po belong to B4. From Christian Mano of PCRH News, Yusek Mirna, kung may data po ba na available sa mga, may data po ba ng mga lugar ba sa NCR na patapos na sa A1 to A3 and kailan po sila pwede mag-start sa A4?
About 80% pa lang ang natatapos sa A1. Tapos yung A2, konting-konti lang kasi konting-konti lang din yung ating vaccine. No? And then initially, kaya mas mababa ang senior citizen kasi he did not allow, there were some studies and then we appealed, tapos pinayagan naman ng INITAG led by Yusek Rosette, na pwede nang ibigay sa senior. So nauna, kaya mas marami ng konti yung comorbidity. So, medyo malayo pa kasi ang senior citizen natin is about 1.4 million ang master listed dito sa NCR, 1.4 million ang buong comorbidity. At ang master list so far nila ay hindi pa tapos. So we look at the different anong tawag diyan, registries. So hindi pa ho natapos yung A2 and A3.
Thank you po, Yusek Mirna. From Sheila Crisostomo, can you please explain daw po what is the difference between deferrals and refusals? Ano daw po ang reasons na ibinibigay for refusing the vaccines?
Ang refusals, we do not really anong tawag dyan, record them because when they come, dapat nakaset na yung mind nila na magpa-bakuna. So yung mga hindi nagpalista o hindi sumisipot during the time schedule, they are considered, tinatanong kung bakit ayaw nila, medyo natatak pa sila. But in terms of deferral, yung topmost is they're awaiting medical surgical clearance. So yung mga pregnant, yung mga for surgery. Tapos yung may mga history of COVID for the past 90 days. No? So may guideline na after recovery pwede nang bigyan ng COVID vaccine. Tapos yan yung hypersensitivity, medyo natatakot pa sila o kaya very strong ang history ng allergy. May mga symptoms at the time of the vaccination, tapos possible interaction with maintenance medication, tapos may heart disease. Although I think with the guidelines already issued with comorbidities, meron na yung mga kailangan clearance if needed for these persons to avail of the vaccine. Ang gagawin lang naman, tanungin nila sa mga doktor nila, for those with serious conditions, pwede na bang magpabakuna o hindi? So those are the main reasons for deferral.
Thank you, Yusek Mirna. Yusek Mirna, just a clarification po from Mikhail. Why are we comparing ourselves with Asean peers in terms of total doses administered and not as a percentage of adult population? Where do we rank in the region based on doses administered per adult population?
I think I answered that already earlier. Ang ating 18 to 59 are already 18 and above are already adult population. Ang binabakunahan naman natin ay talagang adult population. So yun ang basihan. And again, as I mentioned, para makita natin sa mga available na vaccine natin, gaano tayo kabilis mag-administer. So we have reached the 1.4 million mark already. Just to show you na kung may vaccine na ibabakuna naman. Ang problema all over the world is really the shortage. Look at Singapore. They started earlier than us, but they are at 1.6. Hindi pa, it's a small country. Dapat nakabakuna na sila lahat. But I think there are also supply problems in Singapore. Just to show that we are also leveling up.
Yusek Mirna, just to clarify po from Caroline, ano daw po yung mga darating na brands na darating sa April na nabanggit niyo po kanina?
Sinovac, meron tayong Sinovac that are procured. Yung Gamaleya, Sputnik V, Russian made ito. And then meron tayo yung COVAX, AstraZeneca. AstraZeneca is from the COVAX facility. Ito yung mga donation. And then we will have a few Pfizer, about 194,000 that will be arriving. Meron na supply agreement na with Novavax of India, pero hindi pa tapos yung mga agreements. Tapos alam naman natin may shortage. Tapos nagkakaroon ng surge sa India. So we will have to see kung how fast they can also manufacture and deliver to us.
Thank you, Sec. From Aiko Miguel, yung 1 million po na doses, 500,000 doses ng April 22 and 500,000 ng April 29, from what vaccine manufacturer po ito manggagaling?
Sinovac yan. Tapos let us consider, when we look at kasi baka makita nyo, 1.4 million lang ang nabakunahan, pero mga 3.3 million na tayo, kasi may second dose yan. Yung Sinovac, dapat naka-reserve na yung second dose mo, tapos may kadi-deliver last week, so hindi mag-i-start pa lang ng vaccination nila. So it's mostly Sinovac that is available now.
Yusek, from Caroline po of CNN Philippines, in terms of population vaccinated, nasaan po ang Pilipinas sa ranking sa Asean? And bakit po important din itong tingnan? Yusek Mirna?
I don't have in terms of the population because our target is really 50 to 70. Tapos compared sa iba na mas marami ang population. But if you look at Singapore, 1.6. Tayo 1.5 na mas marami. Indonesia has a bigger population than us. We will compute, but this is the data that we have from Bloomberg. That's how they rank, and then from our post. But we can have later how much, what is the percentage of the total population? 1 million out of 100 million is about 1% of the total population. But we are targeting 70 million, so it's over about 1%, more than 1% of the population. Tama? 1 million out of 100 million. So it's about a little more than 1%.
Thank you po, Yusek. Yusek, our media partners po would like to clarify po with regard to the ASEAN. A clarification po from Christine. Iba-iba daw po kasi ang population ng country, so dapat daw po percentage ang tinitingnan. Bakit hindi daw po by percentage of population vaccinated and ranking na tinitingnan natin?
Yung Bloomberg, yan ang kinuha niya, the number of jobs, and then nag-supply lang tayo. We did not have but we can look later kung ano yung pwedeng denominator, ano yung total population nila na gustong bakunahan. As of the moment, sabi ko nga 18 na yan above yung available vaccines, but with Pfizer we can go as far as 16. At sa technical group, based on the policy from Yusek Rosette, 18 years old and above lang, hindi pa tayo nagbibigay ng below 18 years old.
Thank you po, Yusek. From Mikhail, how do we compare to ASEAN peers if we count the number of jabs administered per adult?
Nick, I think Yusek Mirna showed that already. The listing for the top 3, we are after Singapore. That is how we compare it already. And it is their system. It's not our system actually. So they are the ones dictating or requesting. Oo. So hindi siya hindi tayo yung percentage ba or actual numbers. It's the system of that notifications process.
All right, thank you, Yusek, for clarifying. We'll move on to the next question na po, from Greg Gregorio. COVID-19 survivors may now be vaccinated even though they don't qualify sa A1 to A3. This is a question for Yusek Rosette, I believe.
No, we still follow the prioritization framework. It's just that we emphasize that after you recover, you can immediately have your vaccination already if you are part of the A1 to the A3 priorities of government.
Thank you, Yusek. Yusek Mirna, last question na lang po from Jenna Balaoro of GMA News. Follow-up daw po sa arrival ng Sinovac vaccine. Saan po ito i-distribute? Kasama po ba ang NCR? Yung nakaraan po kasing dumating ay pinadala sa Visayas and Mindanao according to Secretary Galvez. Yusek Mirna?
That is not true. May mga batches na prioritize natin ang NCR. Yung 1.4 million initially, 78% binigay natin sa NCR yan. So yung 500,000 na dumating ngayon, binigay din naman natin sa ibang regions because they're only at less than 50% of their healthcare workers. Samantalang sa NCR, naka 80% na tayo. So for this, for the last batch, hindi na zero ang NCR. We just gave them smaller quantities para naman makabigay tayo ng vaccine sa ibang rehiyon. For this next batch that is arriving April 22, about 300,000 out of the 500,000. So ganun ang nag-i-even out lang naman tayo para yung ating most at risk at saka most vulnerable, yung ating healthcare workers sa ibang panig ng bansa ay mabigyan din ng bakuna so that at least they can maangat na sila ng above 50% ang kanilang master listed healthcare workers.
Thank you, Yusek Mirna. I believe those are all the questions that are related to the topic po, as well as for Yusek Mirna. Ma'am, would you like to give a final message po before we proceed to the other DOH questions? Yusek Mirna, may reminders po.
Maraming salamat sa cooperation nating lahat. It is because of a one whole nation, one whole government approach kaya natin naidadala yung vaccine at maibabakuna. Pero sabi nga nila, kung nandyan ang bakuna, ayaw wala naman magpapabakuna, sayang din. So we need all your help in convincing everybody that the best vaccine is the vaccine that is already available. Magtitiis lang po pag hindi kayo sa priority. Kulang pa ngayon, but sa third quarter, magkakaroon na tayo ng mas maraming vaccine, depende sa world supply. And we hope we can vaccinate all of you and reach our targets. Maraming salamat po.
Maraming salamat po, Yusek Mirna. Yusek Rosette.
Thank you very much, Yusek Mirna, for giving the updates and some vital information to our media partners. Maraming salamat po.
Thank you, Yusek Mirna. Yusek Rosette, I think we can start na po for the DOH questions. First, Sofia Toma Cruz of Rappler, will the DOH consider the Philippine College of Emergency Medicine's request to include occupancy in emergency departments and number of patients queuing as part of indicators for the health system's capacity? And in connection to this po, ano daw po ang challenges does the DOH see in this, and how soon can it be implemented, if ever?
Yes, Sofia, no, actually mula pa nung nag-umpisa, na nakausap natin yung Philippine College of Emergency Medicine, we consider this already. Although ngayon kasi internal pa lang yung ginagawa naming monitoring because yung system namin, kailangan namin palitan yung modules para makapasok siya dun sa ginagamit naming system na data collect, no? Yung DDC natin, yung tracker na ginagamit for our bed utilization in hospitals. Meron lang mga konting kailangang ayusin kasi there are different factors that affects these emergency rooms of our hospitals. No? Unang-una, kailangan alam natin what is for COVID and what is for non-COVID. We also need to know the base requirement. Ilan ba yung talagang declared na emergency beds mo for COVID? Ilan yung sa non-COVID? Ilan ba yung in-extend mo, which may tent ka for triaging and all. So these are the factors that we consider para atin pong magkaroon ng standard and templated na para mapapareport na po natin ang mga ospital. And as I've said, it has to be added to the module that we have right now for our tracker. Pero simula pa ho nung nakausap natin ng emergency medicine group, tayo na po ay internally, nakakaroon na po tayo ng ganitong reports coming from our hospitals.
Thank you, Yusek. A number of our media partners are asking related questions with regard to the recent Lancet study on the airborne transmission. Do we have to change our health protocols daw po ba, especially in doing home quarantine even for asymptomatic and mild COVID-19 patients?
Actually, dati pa ho natin yan na ilabas sa mga protocols natin, di ba? If you remember, ang sabi natin, yes, the main transmission, no, ng source ng transmission ng sakit na ito o nitong virus ay through droplet infection. Kaya nga po yung mga minimum health protocols natin ay naandyan talaga. Pero later on, nadagdagan po natin yung mga protocols natin, di ba? Because may studies na lumabas na kapag nasa enclosed space ka, mas naglilinger sa air or nagsistay longer sa air ang virus by about 1.5 to 3 hours, no, according to our experts. So sabi natin dapat adequate ventilation, less talking, less singing, dapat yung physical distancing maintained, and if possible, limit your interaction if you are in an enclosed space because we know that the virus can stay longer in the air. Also, during the outset of the pandemic, nagsabi na rin po tayo ng difference ng mask na dapat na ginagamit natin. Sabi natin, kapag ka tayo, mga ordinaryong tao, surgical mask is okay or cloth mask. Pero for those in the hospitals, they have to use the highly technical mask, no? Yung mga N95 mask po. Dahil, kaya yun po ang advice because outset sa umpisa pa lang nung pandemic, sinabi na kapag nasa ospital ka, because there are a lot of aerosol generating equipments, no, na ginagamit sa ospital, mas nagsistay longer ang virus dun sa air sa ospital. Kaya dapat ang ating mga healthcare workers are using N95 mask. So we have our existing protocols already. Aantayin po natin ang rekomendasyon pa rin ng WHO. Sa ngayon, pinag-aaralan pa rin po yan. Pero whatever we are doing right now, I think is appropriate and sufficient to protect the public.
Thank you, Sec. Next question po from Patricia Denise Chu of Inquirer. Can the DOH give guidance on whether a fully vaccinated returning Filipino still needs to quarantine when he enters the country?
Yes, base po sa sa mga eksperto natin unang-una because of the lack of evidence na itong mga bakuna natin na available sa ngayon na binibigay sa mga iba't ibang bansa at dito sa atin, wala pa po tayong sufficient evidence that it can really block the transmission of the disease. So hanggang hindi pa ho kumpleto at hindi pa sufficient ang ebidensya to finally conclude that these vaccines can really prevent one person from being infected and that person from infecting others, and then we will retain our protocol. So sa ngayon po, kahit fully vaccinated na ang mga returning Filipinos natin, tayo pa rin po ay nagre-require ng same procedures of quarantine and testing.
Thank you po. From Aiko Miguel, FDA BJ Domingo said that the administration of AstraZeneca COVID-19 vaccines to 60 years old below will now resume, and the DOH will have to issue guidelines on the administration and monitoring of vaccinees. What are the specific indications, indications that will be included in the guidelines, and when will this be issued?
Wala, dun sa binigay na rekomendasyon ng Food and Drug Administration, sinabi nga niya, itutuloy na natin uli dahil yun naman ang sinabi ng mga eksperto because the benefit outweighs the risk. Kailangan natin balikan din na napakaliit lang na porsyento ng mga populasyon na naapektuhan ng mga ganitong klaseng adverse events for AstraZeneca. So ang sabi niya, dun sa rekomendasyon niya, kailangan magkaroon lang tayo ng extra precautions. At nagbanggit siya ng mga iba't ibang circumstance, no? Maaring may ginagamit na gamot ang isang tao like yung mga blood thinners at yung iba pa ho na medical, no, na ibibigay natin yan doon sa guidelines na buuin. Pero in the whole at bottom line nito ay at tayo ay maglalabas ng isang guideline para po sa paggamit ng AstraZeneca to include these different precautions na binigay ng Food and Drug Administration.
Thank you po, Yusek. Next question po from Greg. What's the DOH take on Representative Mike Defensor's Facebook post against the use of remdesivir on COVID-19 patients in the country? He included in his post a WHO advisory against remdesivir back in November 2020 while saying, pero ang DOH FDA patuloy pa rin. He said yung mga pinagbayad daw po sa remdesivir dapat ma-reimburse kayo dyan. May sakit na binabaon pa sa kahirapan. Yusek?
Yes, klaruhin po natin. Gusto natin maintindihan maigi ito ng ating mga kababayan. Ito pong WHO recommendation na to for remdesivir was part of the clinical trial. If you remember the solidarity trial for drugs ng WHO, kasama po dyan ang remdesivir. At dyan po sa clinical trial na yan, during the time na nag-evaluate na sila midpoint into that trial, sabi nila, wala pa rin tayong nakikita na positive outcomes from remdesivir. Wala pa rin hindi pa rin niya na ipapakita na it can prevent deaths among the COVID-19 patients. So sabi niya doon sa rekomendasyon specific, ituloy pa natin, no? The countries included into the solidarity trial can still pursue the clinical trial para mas madami pang pasyenteng ma-enroll, baka mabago at makakita pa tayo ng ibang epekto ng remdesivir. So WHO recommended that as part of that solidarity trial for vaccines. Pero hindi lang naman po WHO ang gumawa ng clinical trial for remdesivir. Meron pa hong iba na trials na ginawa for remdesivir. And I think these are 3 na in-evaluate po iyan ng Living CPG group natin, kung saan iba't ibang medical societies ang kasama dyan. Isa dun sa trial na yun po, nagpakita siya na merong clinical improvement, no? Clinical improvement ang ating mga pasyenteng may severe, no, or requiring oxygen when they had remdesivir part of their management. So this was one of the bases why the Living CPG recommended that it can be used through a CSP. This is the Compassionate Special Permit Pathway, kung saan ang isang hindi rehistradong gamot, pagka ang specific hospital or specific doctor ay sa tingin nila this can be good for their patients, they can go through that pathway. Pero hindi po sinabi ng WHO outright na remdesivir in the whole context. This was based on the clinical trial done on the Solidarity Trial for Drugs. Meron pa hong ibang mga trials na ginagawa din na nakapagpakita ng clinical improvement. So ang sinasabi lang ho natin, lahat naman ng gamot, open tayo for use here in the country. These off-label drugs, these investigational drugs, gusto ho natin yan para may maipanggamot tayo sa ating mga pasyente. Pero kailangan lahat to go through the regulatory and the scientific process. Ang scientific process po, yan yung clinical trial. So itong clinical trials na sinasagawa natin, yan ang makakapagbigay sa atin ng accurate na rekomendasyon kung tayo ba ay talagang gagamit nitong gamot o hindi. So lahat po ng investigational products ngayon undergoing clinical trials, and until we can have that concluded or conclusive evidence, no, para sabihin na gagamitin itong gamot na ito, tsaka po natin ilalagay yan dun sa ating mga ginagawang protocol. Sa ngayon, everything na meron tayo ngayon as investigational, nagko-compassionate special permit po. Yung mga doktor o kaya mga ospital na sila po ay sa tingin nila makakabuti ito sa kanilang pasyente, meaning the benefit outweighs the risk.
Thank you, Sec. We hope that's clear po, no? Next question po, the DOH reminders daw po for typhoon from Aiko po. May paalala daw po ba ang DOH sa mga madadaanan ng kalamidad gaya ng bagyo? Ano po ang dapat nilang gawin para maging safe sa evacuation centers?
Yes, Aiko, no, nakapaglabas na tayo since Saturday. We had been preparing for this. Nakausap na ho natin ang ating mga regional directors, especially dun sa mga areas na talagang magiging affected, no? We were also able to do preemptive evacuation already in some of the areas, at tayo po ay nakapagpaalala na nito mga minimum health protocols that has to be implemented in all of our evacuation areas. At very aware naman po ang ating mga regional offices about this matter. As to the patients din, na pasyente mismo na may COVID-19, if they are to be evacuated, we also gave that instruction. Kailangan may facility ka for COVID patients and may facility ka for close contacts who are all quarantining. Hindi pwedeng i-mix sa rest of the population who are being evacuated.
Thank you, ma'am. Next question po still from Aiko. May nakahanda po ba ang DOH na mga standby health workers sa mga evacuation centers para mag-evaluate po?
Yes, we already have 32 teams that we were able to mobilize last Saturday, and they are ready for deployment. Actually, de-deploy na nga yung sa mga Region 5 sa ngayon para tayo ay makapag-monitor na at makita natin ang sitwasyon. Although aside from these deployed teams that we will be providing, nag-umpisa na ho ang regional offices natin, and actually we already were able to receive the report yesterday, no, coming from our regions, kung paano nila inaayos ang evacuation sites nila, kung ano yung mga pre-position natin ng mga logistics para dun sa ating mga kababayan na maaring maapektuhan itong bagyong to.
Thank you, Sec. In relation to that po, may paalala din daw po ba tayo sa mga nag-home quarantine ng mga COVID-19 patients? And ano po ang dapat naman nilang gawin kung kinakailangan na din nilang lumikas? Saan po sila ilalagay?
Kailangan po natin makinig kung anong sasabihin sa atin ng ating mga local governments. Local governments were already instructed to set up a facility which are separate from each other, all for those with COVID and all for those who are close contacts who are undergoing their quarantine at home right now. So kung kinakailangan nyo pong lumikas, dyan po sa bahay nyo dahil nandyan po yung danger because of the storm o itong bagyong parating o nandyan na, kailangan lang po na makinig tayo sa barangay natin, sa ating mga local government kung saan po tayo dapat dalhin. Bibigyan niya po kayo ng isang lugar kung saan hindi po magiging threat na makapanghawa tayo o di kaya ay mahawa tayo sa mga nasakit dito sa COVID-19. So antay lang ho tayo ng advisory from our barangay officials.
Thank you, Yusek. Yusek, I'll be moving to the questions that were sent in the chat box from Lay Alves. Ano daw pong update sa ginagawang pag-aaral sa transmission ng bagong variants?
Yung ating mga experts pinag-uusapan niya, no? And we are actually, ang detection is there already. So, paano na yan? The variants had been detected. Ano-ano itong variants na nakita natin? Nakita na natin na may 4 na klase na variants, 3 variants of concern, 1 variant under investigation. Alam na rin natin yan. Ano ang distribution dito sa ating bansa? Nakakakuha na tayo ng pangilan-lilan, even dun sa ibang rehiyon na nakakakuha na tayo ng report. So ano ba ang pinag-uusapan ng mga eksperto ng WHO at saka yung mga eksperto natin? Unang-unang pinag-uusapan is how do we make the surveillance for these variants more rational, na mas magagamit natin yung datos base dun sa mga nakukuha natin. We have to remember that we only have 750 samples. That's our capacity every week. No? So kailangan yung 750 na yan ay nai-allocate natin rationally distributed across the regions para mas makakuha tayo ng tama at accurate na trend nitong variants na ito. So when we look at the variants right now and how it is distributed, nakikita natin na talagang dito sa NCR ay talagang marami ang kaso natin itong mga variants na to. Nakita rin natin that aside from NCR, we are seeing Northern Luzon, no, na meron tayong mga lumalabas na ng mga variants. Yun pong sa Region 7 na P.3, nakikita rin natin na nadadagdagan pa rin po itong variant na ito. And yun ngang latest, yung P.1, may 2 po tayong na-detect sa ngayon and we are still studying the details for this.
Thank you, Yusek. From Red Mendoza, according to the research, yung continuous na pagtaas ng kaso natin is a sign that the MECQ is not working to what it was intended. Ano po ang reaction ng DOH dito?
Unang-una, sa tingin namin, kailangan pa natin tignan ng ilang araw pa bago masabi natin na hindi siya nag-work. Lagi natin babalikan yung incubation period ng virus, kung ilang araw po nagtatagal ang pag-incubate ng virus sa isang tao at mag-manifest ng symptoms o di kaya mag-positive siya sa kaso. So pag tinignan ho natin, katulad ng lagi naming sinasabi, during our past experience with this increase in cases, it took us about 10 days after we did the stricter measures bago tayo nakakita ng pagbaba. So it took us also about almost a month before we finally have decongested our hospitals just down to about 70% utilization. So ito, unti-unti po ito, step by step. But kailangan tignan din po natin that as we go through this process, atin pong ine-expand yung kapasidad para mas maka-accommodate tayo. Sa tingin ho namin, ito pong mga referrals, pagpasok ng pasyente, tsaka pagpuno ng mga ospital. No? Ang isang factor dito would be those inside the hospitals already are being upgraded, no, to higher level of care. Katulad ng ICU. No? Kung nandun na siya sa ospital, nag-progress, pumasok sa ICU. So tinitignan ho natin yung mga pathways ng pasyente to appropriately analyze kung talagang nababawasan ba ang pumupunta sa ospital at nasa loob ng ospital ang pagtaas ng mga kaso na ma-upgrade to isolation or ICU beds. And we are also looking at the patients who are already being triaged by our local governments. So ito po ina-analyze ng isang buo at magbibigay naman tayo ng ganitong klaseng analysis, no, maybe by next week para mabuo lang natin. Pero for now, as I've said, I think masyado pang maaga para magsabi tayo na hindi talaga umiepekto. Bigyan pa natin ng ilang araw, tignan din po natin yung naging epekto nitong mga nadagdag po nating mga kama sa ating mga ospital at saka yung pagsasagawa ng institutionalized triage system sa local governments po natin.
From Raul Dancel as well as from Christian Manyo, in relation po to community pantries, ito daw po yung mga donors po na nag-drop off na items and beneficiaries are rummaging and picking through items on the cart with little screening for quality and safety, especially with hundreds queuing at any given hour at some pantries. Ano daw po ba ang advice ng DOH on this to avoid possible COVID-19 transmission?
Yes, Nick. No? So actually, unang-una, nire-recognize po natin yung effort ng ating mga kababayan na talagang tutulong po sila sa ating mga nangangailangan. And that is very important dito po sa pagtutulong-tulungan natin lahat to respond to this situation. Pero kailangan lang siguro mag-guide sila ng local governments natin kung paano dapat ang proseso para po hindi rin nagkukumpul-kumpul ang mga tao, hindi rin po nagkakaroon itong mga pagdampot lang ng pagkain na hindi na natin nakikita kung gaano ang kaligtasan for health kapag tinignan natin. So I think yung advice lang po ng galing sa ating mga local governments on how to guide them, maging mas organized, maging maayos. Pero hindi kailangan namang itigil dahil sa tingin ko malaking tulong din po ito both sa physical wellness at saka sa mental wellness ng ating mga kababayan. Yun pong mga nakikita nila na may mga handang tumulong ay malaking bagay po yan para sa kumpiyansa at saka para po sa wellness nga mentally ng ating mga kababayan. So I call on our local governments na sana po tignan po natin itong mga pantries na ito. Bigyan lang ho natin ng guidance kung paano natin mas maisasaayos ang proseso para organized and we can prevent further infections dulot po ng mga pantries na ito.
Thank you, Yusek. From Greg Gregorio, Hong Kong detects a so-called mutant strain of the SARS-CoV-2. What do we know about this po? And also, Hong Kong has banned travel to the Philippines. May reaction po ba ang DOH dito?
Wala, kanya-kanya po ang bansa na pagpapatupad ng kanilang mga restrictions at tayo po ay rumirespeto dyan. Kung matatandaan nyo, nung bago matapos ang 2020, tayo rin po ay nag-restrict sa ilang mga bansa dahil nga sa UK variant na atin pong na-detect. So it is the prerogative of any country to have their restrictions. At ito naman po ay nagkakaroon na ng common understanding across country when it comes to these restrictions because we just like to prevent further spread across borders. Naiintindihan po yan ng lahat ng bansa. And kasama po yan sa response internationally. Ngayon, ito pong mutation na na-detect sa Hong Kong, we still need to further look at the evidences available para makapagbigay po tayo ng accurate information.
Thank you, Yusek. From Sofia Toma Cruz, a quick follow-up lang daw po. When might the DOH start including emergency department numbers in the tracker? And do we have a timeline daw po for this?
Tinitignan natin, Sophia, it's not, hindi po ganun kadali yung mga modules na dinadagdag sa tracker natin at saka kailangan pa rin po namin pag-aralang maigi kung ano talaga yung standard across hospitals that we will be employing para alam po natin yung measurement will be comparable. So maybe give us 1 to 2 weeks for this and we will be able to report this already.
Thank you. Like from Miguel Flores, where are we at with the HCUR? How many mild and asymptomatic patients are still in the hospitals?
Miguel, last week we had that downward number wherein 38%. Last week, yung asymptomatic and mild. Pero this week, I think that was yesterday, 41% siya ulit. So we are constantly changing this. Araw-araw nababago to kasi araw-araw nagbibigay ng report sa amin ng mga ospital across their different patients. At nakikita natin kung ilan nga yung mild and asymptomatic. Most of these patients are nearing discharge na rin. Kaya nga po yung programa din natin na step-down care ay pinag-iigting sa mga ospital so that we can further decongest our hospitals.
Thank you. So in relation to that po, Aiko's question, marami pa rin po ba ang mga nakapila para ma-admit sa mga ospital? And ano pa po ang pinapatupad ng mga aksyon na IATF at DOH para madagdagan ng mga COVID beds? Gumagana na po ba ng maayos ang One Hospital Command Center nila?
Yung One Hospital Command ay nagkaroon sila ng na-decongest, yung mga calls sa kanila. Hindi na po ganun ang traffic sa pagtawag nyo dun sa One Hospital Command. Na-manage na po, nakapagdagdag po din tayo ng mga tao, nakapagdagdag din tayo ng mga equipment, so nakaka-better access na po ang ating mga kababayan sa call sa One Hospital Command. Nagkaroon din ng epekto sa One Hospital Command to decongest the calls for One Hospital Command nung unti-unti pong nakapagbigay na ng institutionalized hotlines ang ating local governments. So local governments right now are helping us navigate already patients. So ang mga pasyente, na na-navigate na natin if kailangan sa ospital o sa temporary treatment and monitoring facility o pwede naman sa bahay using the telemedicine. So ito po unti-unti ay nagkakaroon po tayo ng ganitong mga sistema to further decongest our hospitals and to further manage incoming calls and needs of our citizens when it comes to our hospitals. So ano pa ang karagdagan? Sa ngayon po, we are trying very hard to negotiate for these healthcare workers that are needed for the different hospitals. So ngayon, ang ginawa natin, we are deploying healthcare workers coming from other regions, but we need a more longer term solution to this. Kaya nga po yan pinag-uusapan na ngayon sa aming mga policy groups so that we can find a solution kung paano po natin mas madadagdagan pa to augment our healthcare workers, especially in our hospitals. Of course, additional beds are being planned. Meron na ho tayo na target, sabi natin sa ICU beds, sabi ng mga eksperto, at least 500 additional would be sufficient for now. Pero gusto natin ipagtuloy-tuloy yan, kaya tinitignan na ho natin lahat ng aspeto para we can expand further our ICU bed capacities.
Thank you. From Luisa Irispe, sa Pasig City General Hospital, merong mga medical workers na nabakunahan then subsequently nagka-COVID pero mabilis na gumaling. Hindi raw po sila dumanas ng severe COVID. May reaction daw po ba ang DOH dito?
Well, pag nabakunahan naman ho tayo kahit first dose, di naman natin sinasabing 0% yung inyong nakuhang efficacy. Meron na ho kahit papaano na epekto yung first dose nyo sa inyo. And katulad nga ng sabi natin, ang pangako ng mga bakuna, hindi ka man ma-prevent na magkaroon ng sakit, pero ang pangako niya, yung lessening the chances of you having severe infections and being hospitalized and yung pagkakamatay ay nababawasan because of this vaccine. So maybe yun pong unang dose nila, nag-work na po kahit papaano at nagkaroon po ng ganitong prevention. Pero sana po itong information na to would not lead to complacency. Because ang lagi rin pa rin sinasabi ng ating mga eksperto and evidences across the globe, you get the full potential of the vaccine about 2 to 3 weeks after you get your second dose. So sa ngayon po, pag nag-first dose tayo, we continue with our compliance to the minimum health standards. And even after you get your second dose, kailangan pa rin tuloy-tuloy. Kasi sabi nga natin, maaari ka pa rin magkasakit, maaari ka pa rin makapanghawa, pero hindi ka na magkakaroon. Lesser chances of having severe infections.
Thank you, Sec. From Lay Alves po, a follow-up. Dominant na ba ang variants?
Lay, katulad ng pinaliwanag ko kanina, what we get from the samples that we do for surveillance, these are randomized collection of samples sa iba't ibang bahagi ng bansa. The main objective is first that we have that evidence na yes, the variants are here. Second, tinitignan natin yung trend across the different areas, di ba? Hindi natin kailangang malaman na lahat ng tao tinest for variant. So pag tinignan natin sa isang lugar at nakikita na natin na marami siya, may mga clustering, we can say na itong lugar na ito ay kailangan mas mabantayan, kailangan talagang ipatupad yung ating mga minimum health protocols ng talagang ang behavior has to change para ma-prevent natin ang further spread nito. As to saying that the variant is dominant already across the country, I do not have that answer right now because as I've said, we only get bits and pieces across the different regions. But this is still not conclusive to say that the variants have taken over and this is the dominant variant of the SARS-CoV-2 right now here in the country. We will have that answer maybe across, or moving forward, more weeks of sequencing and more weeks of analysis.
Thank you, Sec. From Sofia Tomacruz, follow-up din po sa LGU triage system. When will this become active and how can people avail of this if they think they need to be hospitalized already?
Na ipalabas na ho, kahapon or nung Sabado, kumakalat na nga yung newest version ng mga iba't ibang hotlines ng bawat local governments. Hindi na lang po isang numero yan, iba't ibang numero po inilagay na nila dyan. They have expanded their hotline so that they can, people can access better itong kanilang mga hotlines. Aside from that, pinakalap namin itong mga telemedicine hotlines natin. So ang isang tao na nasa bahay at sa tingin nila kailangan na nilang ma-ospital, kailangan na tumawag agad sa hotline ng local government para agad-agad kayo po ay matulungan. Kailangan din po maintindihan ng ating mga kababayan, wag din tayo nagpapatagal sa bahay. So if you are already feeling something which is out of those common or mild symptoms for COVID, mas maganda na po, first step natin, pwede telemedicine, then they can guide you what to do at home. And if you are supposed to go to the referral hospital, pag hindi naman po local governments, you can easily call them, just call them so that you can get the help that you need.
Thank you, Yusek. From Caroline po, kailan po this week posible makita ang effect ng ECQ? This is to determine if the ECQ help decrease cases po.
Yes. So when we started our ECQ, that was, hindi ko maalala kung kailan, but you count the 14 days, maybe 14 to 20 days, and then we'll see the effect of this ECQ. Actually, pag tinignan natin, unti-unti naman nakikita na natin. Kasi tatandaan natin ulit, no? Hindi lang po numero ang tinitignan nating epekto sa ECQ, kailangan tignan natin yung system capacity natin, which is part also for parameters, local government's capacity and the hospital capacity. So pag tinignan natin, dito sa mahabaan nating restriction na ginagawa sa ngayon, marami na rin naman po na na-improve sa ating sistema. Although of course, hindi pa natin nararating yung main objective natin of decongesting our hospitals, and that is our final outcome na gusto makita.
Thank you, Yusek. I'll go through the last 3 questions po that are sent here in the chat po. From Dreo Calonso of Bloomberg, a categorical answer daw po, Yusek, if DOH has approved AstraZeneca's resumption on under 60 years old.
If AstraZeneca, again,
if the DOH has approved AstraZeneca resumption on under 60s po.
Yes.
Okay po. From Miguel Flores of AFP USEC, pa-clarify lang po on the current occupancy rate of hospital beds. What is the percentage now daw po?
We'll give you those details, Miguel. Marami masyadong porsyento na kailangan ipakita. Pero we have that and we will be posting in our Viber.
Thank you, Yusek. Last na po from Caroline. At this point, may data na ba if may community transmission na ng new variants sa NCR? And so far sa ngayon, may nakikita na po bang improvement? And ano po ito?
Wala pang binibigay ng WHO na rekomendasyon as to the level of transmission of the variants, no? Usually it's WHO which classifies, no? Based from our discussions with them and the data that we give them. So hanggang ngayon, wala pa ho tayong rekomendasyon from WHO if we will already classify Metro Manila, for example, as one having this community transmission. Marami pong implikasyon yan pag nagka-classify na WHO, hindi lang po dito sa ating bansa, pati internationally. So kailangan very, very cautious and very tedious yung proseso para mapag-aralan kung talagang may community transmission o wala. Because these have international consequences or impacts, no? Merong pong mga aksyon na ginagawa kapag dito based on international health regulations. Ano yung second na question?
So far sa ngayon, may nakikita na po bang improvement and ano po ito?
Improvement sa variants?
Sa community transmission po and the variants. Yes, Yusek.
So ngayon, nakikita pa rin natin, dumadami.
Sa ECQ, sorry Yusek, sa ECQ daw po. Effect daw po ng ECQ, may nakikita na po tayong improvement.
Sa ngayon, wala pa ho tayo masyado makita, no? Based on the parameters that we use, di ba? Yung ating 2-week growth rate, nakita natin medyo bumababa siya dati, last week, pero ngayon tumataas siya uli. Yun pong average daily attack rate, mataas pa rin po even in the various cities of Metro Manila. Yun pong ating healthcare utilization rate natin ay naandun pa rin tayo dun sa critical risk when it comes to ICU beds. Pero kapag tinignan naman ho natin yung ating response on the other side, no, of what we measure also, nakikita natin yung heightened response. Nakikita ho natin na kapag dagdag tayo ng mga kama, na-improve ho natin yung testing capacity natin. Ang local governments po ay nakapag-intensify ng kanilang PDITR at katulad nga ng sabi ko, even the triaging system ay patuloy na inaayos. Quarantine facilities, beds are being added. Yung mga pagbabakuna ho natin na scale up natin dito sa NCR. So looking at both of these factors, no? So sabi ko nga, it's not really just the number, it's not really just the HCUR. We look also at the localized responses and the other things that we do for the response. Makikita ho natin na bagamat di pa natin nakikita yung mga numero na bumababa, hindi pa rin natin nakikita na talagang yung ICU beds natin ay medyo na-decongest. but we can see improvements in how we are responding. So hopefully, all of these improvements sa pag-respond, excuse me, improvements sa pag-respond, it will give us that outcome that we want, no, for the next days. And that would be decongesting our hospitals and also having the numbers decline already. Nick?
Thank you, ma'am. Ma'am, last na lang po from Greg. Pwede daw po ba ulit pa-emphasize yung difference ng variants of concern against variants under investigation?
Yung variants of concern, Greg, nakapaggawa na ng conclusive evidence ang WHO and the other experts na nagka-classify nito para masabi na of concern na siya. And the examples of this would be yung UK variant, yung South African variant, yung P.1 na variant, no? Itong mga variants na to, pag pumapasok sa isang bansa, nag-identify tayo, sinasubmit natin doon sa WHO listing at sila po ang nagka-classify kung ito ay of concern or under investigation. So once evidences are conclusive already for a specific variant na dito sa SARS-CoV-2 na ito, kina-classify na nila yan as variant of concern. Yung variants under investigation like the P.3, ito po yung nakita natin unang-una sa Central Visayas, di ba? Ito po, sinubmit na rin natin sa kanila and up to now, it's still a variant under investigation kasi patuloy pa rin kumakalap ng ibang ebidensya ukol sa variant na to para masabi kung ano ang epekto nito sa populasyon, ano ang mga kailangan gawin ng ating population, and what would be the lineages of these types of variants. So marami yung pinag-aaralan bago masabi na ang isang variant is of concern. When it's under investigation, further studies are needed para po mas magkaroon ng mas maraming ebidensya para dito.
Thank you, Yusek. We hope that's clear po. No? Yusek, we have reached the last part of our media forum. Ma'am, may reminders po pa kayo to the public before we end today's forum?
Yes, I'd like to thank first Yusek Mirna Kabutahe for the updates that she has given to our media partners and our public. So ang reminders lang ho natin, pareho pa rin sa ating mga minimum health protocols. So bagaman ang mga hamon sa atin, nakikita natin na ang mga kaso ay mataas pa rin, ang atin pong mga ospital ay medyo challenged pa rin. Pero sana po bilang mga Pilipino, kasama natin mga citizens of this country, tayo po ay makatulong by having this compliance to the minimum health protocols. Ito po ang maitutulong po natin para magkaroon na po ng kaayusan at saka ma-decongest natin ang mga ospital. Sana ho tumulong tayo by always wearing your mask and your face shield. Huwag ho tayong pupunta muna sa matataong lugar. Kung sakaling kailangang lumabas, kailangan lang po na dun sa mga well-ventilated areas, kailangan laging suot ang mask at face shield. At kung sakasakali, please limit your interaction with other people to less than 15 minutes. Kung wala naman hong kailangan gawin sa labas ng bahay, maaari pong manatili muna po tayo sa ating mga tahanan para po makaiwas tayo sa infeksyon. And ang pinaka-importante po ngayon, kailangan po magpabakuna na po kung kasama na kayo sa priority list A1 to A3. Ito po ay isa sa pinakamabisa na pwede nating panlaban dito po sa sakit na ito. Ang science ang atin pong katuwang upang gabayan ang mga pagsusuri sa ating responde kontra COVID-19. Maasahan niyo po na ang ating mga eksperto ay patuloy na nakatuon sa ligtas na pagsupil ng pandemyang ito. At ang ating mga policies at interventions ay laging nakabase sa karampatang evidences at pagbalanse ng pangangailangan ng ating bansa. Bilang mga mamamayan, kumilos po tayo na ayon sa ating responsibilidad sa ating mga kapwa Pilipino at itatak po natin sa ating mga puso at isip ang ating pag-iingat would be the key o ang susi sa atin pong muling pagbangon at saka pagpapatigil nitong ganitong sitwasyon sa ating bansa. So thank you very much and we will see you on Wednesday. Thank you, Nick.
Thank you, ma'am, and to all our media partners.